physical therapist. Oh, I have to hit, got it. Okay. Ann Reilley is a physical therapist. She holds a doctorate in physical therapy, a master's degree in exercise science, and is board certified in geriatric physical therapy. She specializes in physical therapy and fitness training for the older population. Amanda Reilley is the practice manager for Reilley Physical Therapy and holds a bachelor's degree in wellness management and health science and is a certified health coach through the American Council on Exercise. She specializes in helping older adults set and attain personal goals related to healthy aging. We really appreciate both of them taking time out of what I know is busy days, because actually Ann Reilley has been helping me with my physical therapy and Amanda is the one who's been answering the phone, so I know they're busy. If everybody would please, I think everybody is muted except for me, so I'm about to mute and let them take it from here.
Thank you, Betsy. Welcome, everybody, and welcome to those of you that will be watching this as a recorded discussion. I like that I see some familiar faces on the lecture, and I'm assuming that some of the people that will be watching this recorded are people that I've worked with before or seen in other discussions that we've done. So I'm going to share my screen so that you can view our PowerPoint slides. I'll share mine for the first portion of the discussion, and then I'll hand it over to Amanda. So our topic today, the title is Spring into Action, very appropriate for the start of the spring season as the weather changes and it's warmer outside. It's more tempting to get outside and also more tempting to get up and just generally move more and be more active and exercise. So we're going to talk today about the benefits of getting moving during the spring season and some guidelines for that. This slide is just our contact information. So if there's any questions after the lecture that you want to reach out for an individual question that you don't want to bring up on the group discussion, we will make sure that these slides are sent out in an email to the group so that you all have access to this later. So I'm going to talk a little bit about exercise and physical activity benefits, a little bit about aging muscles and why exercise is so important for us, for adults and older adults. And then we're going to spend I'm going to spend most of the time that I'm going to be discussing this content on activity guidelines. So how much exercise and activity should we be shooting for, and what types of exercises qualify for different fitness components. Then I'm going to hand it over to Amanda, and she's going to talk a little bit about goal setting and getting started with an activity program, or if you're already in an activity program, goal setting and progressing and making essential changes to that program. So we know that there are numerous benefits to exercise and activity. All systems are benefited. There's benefits to our cognitive health, our alertness, our mental well-being, benefits to the heart and the lungs, benefits to our immune system, even our GI system. Our GI system meaning our stomach and our bowels, helping digestion, our muscular system, our bones, our joints. All systems can benefit from activity and exercise. And there's a lot of research on this. We're constantly seeing articles coming out in the New York Times or other, the NIH puts out articles for older adults on different updated research on all of these benefits we know that we can achieve from exercise and activity. And the concept here that Amanda and I really want to focus on is the idea of exercising and staying active in a way that helps you move well so that you age well. And age well means something different, or optimal aging means something different for everybody, but doing the things that you want to do. And that's something Amanda's going to talk about later with goal setting. Most of the time that people lose the capacity or the ability to do the things they want to do, it has something to do with loss of some sort of fitness component, physical or mental capacity, and sometimes that's in response to an injury or an illness or some sort of complex situation that's occurred. And the goal is that you are able to move and recover from that and continue to move well so that you age well. This slide is This is called the slippery slope of aging. So the slippery slope of aging is a concept that's used a lot in the research when we talk about muscle mass changes over time as we age, and what can happen and how that can impact our function. And so on the vertical side here, we see this for percent of vigor or energy or capacity from 0 to 100%. And then on the bottom, we see that we see age. And what often the trends are, what we see is that people are functioning at the high end of their vigor or capacity and in a fun category. Fun category here at the top, meaning doing everything you need to do on a daily basis to function around the house, for your job, your volunteer activities, whatever it is that you might, taking care of family, whatever it is that you're required to do to function. And on top of that, you have extra energy and capacity to exercise or do a fun social event, participate in fun activities that you like to do. And that could be physical activity. It could even be something more sedentary that's engaging. Sewing and quilting isn't necessarily exercise, but it's engaging. And then the next category down is function. Function is functioning to do the things that you need to do, what your job requires, your family life requires, or just the essentials to get through the day, and not having any reserve or energy to do anything fun that you'd like to do. You're tired at the end of the day, or you know that if you do go out for a hike or go out and garden, and that's in the fun category, that you might not have to have energy later to make dinner. And so that's that function category. And then we see below that, people lose any more strength or capacity into what's called frailty. And frailty is now needing help to function. So this would be needing help to take care of yourself throughout the day, needing help to prep meals. You might not have enough reserve or capacity to do the things that you need to do to function. And failure, that's quite a negative word, but failure to thrive is a common term used when we think about functioning level. That's really being dependent on somebody else to care for you. And the idea here, when we think about the slippery slope of aging, this isn't to demonstrate that this is actually what happens with everybody. It's to demonstrate that the further down you get in the slope, so if you move from fun to function, it's much easier to reverse that and climb back up into fun. But the farther down you get down that slope, and this is what the research shows, that's why we call it the slippery slope. It's like sledding down a hill that gets a little icier and slipperier and faster as you get to the bottom. It becomes less likely that you're going to be able to reverse your capacity and gain fitness if you move down further down that slope. So this is an important piece to why Amanda and I do what we do and why I want to talk to people about staying active and exercise, so that people stay up in the function and fun zone until much later in life. Really what we'd like to see, and we help people strive for, is that they're staying really high up in that percent of capacity and vigor until the very end of life. And then there should be a steeper decline instead of a very gradual slippery slope downhill. So this is just a demonstration of what really it sums up the overall benefits for adults and older adults. And I say adults because if you look at the age down here, people actually often, people that are not exercising or staying active actually start losing some of that capacity in adulthood. It's not just older adults. It becomes more apparent as we get older, usually because of accumulation of diseases, illnesses, and the accumulated years of potentially being inactive. But it can be slowed, it can be reversed, and people can stay in that fun zone with regular exercise through adulthood. So I want to talk a little bit about physical activity and exercise. I'm not going to read these definitions, but those two words are often interexchanged with each other. And they're really two different things. Physical activity is not structured, necessarily planned exercise. It's bodily movement that you do throughout the day. So walking to the mailbox is physical activity. Parking farther away from the stores instead of parking close to get more steps, that would be physical activity. Cleaning your house is physical activity. Structured or exercise is something that you're planning, you do that's planned with the intention of purposely improving your balance, your strength, your flexibility, or your endurance. So a planned walk that you say, I'm going to go outside and walk 1 mile, or I'm going to walk for 5 minutes, something that's very structured and planned. I'm going to take this strength exercise class. That's exercise. And physical activity and exercise are both important. We should be striving to be as active as possible with unstructured and unplanned movement. And we should also have some planned exercise built into our week to meet the recommendations and guidelines for healthy aging. So I'm going to talk a little, mostly about fitness and exercise. So this is that structured, planned movement. These are the key categories of exercises that the CDC, the American Council on Sports Medicine, and the National Institute on Aging recommend older adults to include in their week. I'm going to talk about these. We're going to define them, talk about examples of what would be included in each of these categories, and how much of this is recommended. So endurance, muscle strength and power, balance, and flexibility are the 4 key categories that we're going to talk about. Excuse me. This is a physical activity pyramid that I like to look at this similar to that concept of being physically active as much as possible as the base of the pyramid. So most of your time moving should be being physically active so that you're cutting down on sitting time, which is at the top of the pyramid. In the middle should be that planned exercise. So in the middle there, a couple times a week for strength and power activities, a few times a week for flexibility. Balance is not on here, but it should be. I have a different one that isn't as visually appealing that I use. It's that I have balance up there in the center near strength and flexibility. And then planned recreational or aerobic activities. So if you think about in the week, and again, I'm going to talk about how many minutes of each is recommended, but this pyramid is a nice visual for the base of it is moving more as much as you can throughout the day. And then in the middle, structuring out 2 to 3 times a week, each of those fitness components. So first fitness component that we're going to talk about is aerobic endurance. So aerobic endurance is, it's a sustained activity. It requires repetitive motion so that it increases your heart rate and the demand that your lung and your heart have to supply oxygenated blood out to the muscles. So it improves your heart and lung capacity and your muscle, the circulatory system that supplies blood flow to your muscles, the efficiency of both. Muscle endurance goes along with aerobic endurance. If you're training your body for aerobic endurance, walking is a great example. Swimming was the picture on that prior one. Biking, any of those activities that require repetitive motion, you're also working muscle endurance. And muscle endurance is training and improving the muscle tissue's ability to do a light load repeatedly for an extended period of time. So walking, again, as an example, any type of aerobic exercise class where it's aerobic endurance and muscle endurance. So as far as examples of endurance exercises, I would, again, combine aerobic endurance for the heart and the lungs and the circulatory system along with muscle endurance, because if you're working one, you've got to be working the other. Examples, again, aerobics, hiking, this time of year, gardening and yard work. If you're doing something that's a repetitive motion, and you're noticing that your heart rate is increasing and you're doing it for at least 10 minutes, very likely you could plan gardening and yard work in a way to help get that structured amount of aerobic and muscle endurance activity. Swimming, biking, golf could be included on here, especially if you're walking in between holes, or even if you're using a cart for part of it. But if you walk, you choose to add in some steps and walk, golf could be included on here. Dancing is another one, structured dance time that is, again, that repetitive motion. And then ways that you can get this as less structured exercise, but throughout the day. Playing with grandkids or children, that can be tiring. I have a 4-year-old at home, so sometimes that's how I get my daily, my general unstructured aerobic exercise is keeping up with her. Shopping, walking to the mailbox, again, cleaning your house. I mean, depending on the pace that you're moving at, that can be, again, a daily activity that you can achieve some endurance benefits from. Before I move on to the next fitness component, does anybody have any other ideas, especially when we think about springing into action, ideas for ways that you can get some endurance exercise outside or inside? Okay, I'll move into strength. If you think of anything, please chime in. Strength, muscle strength.
And
Yes.
I was going to say, specifically, I suppose it falls under one of the categories that you mentioned, but if your hips or whatever can handle it, specifically choosing hills, up hills.
Yeah, so walking outside and mixing in some hill work. We say when you're first starting out a walking program in the spring, ease into the hills. But if you're in Tompkins County, it's not hard to find hills to add into your walking program. That's a great way for getting a mix of aerobic and muscle endurance, but also going uphill for a short distance. That higher intensity work on your leg muscles can also add a little strength work into the exercise as well. Hills, and then the other piece to that, I was just thinking, Betsy, as far as variety in your walking program, is changing the surface. So if you have a route, a lot of people have a pretty consistent walking routine, and sometimes it's more challenging for your balance and even your leg muscles to try, go to a different park or a walking trail or something that's uneven, and that adds a little bit of fitness benefit as well. So muscle strength. Oh, go ahead.
And you had mentioned to me anyway, and I had heard this, that sometimes that treadmill walking it's good to switch that out.
Yes. Yeah. So treadmill walking is a great alternative if you have access to it for rainy days, or definitely to get through some of the winter months. But it's nice to switch from treadmill to outdoor. And even if you're going to stick with treadmill walking for more consistency and control, some people like the treadmill because they can keep a little closer track of the speed and all of that on the panel. You can change that by changing. Sometimes you spend 30 seconds going uphill, back down to more level. You can change the speed and do kind of like what we call intervals, where you're doing a portion of it a little bit easier and then a minute or two with a harder level, so that you have variety on the treadmill, similar to what you would have if you were walking around a neighborhood. So muscle strength is quite different than in muscle endurance. So muscle strength is the ability of a muscle or a muscle group to maximally contract to lift something very heavy. And the definition is to lift something heavy one time, and then your muscles are pretty tired. So the true measurement of strength is trying to figure out, there is a way, a protocol for, let's say, a squat or a lift. And this is something that's done in research and more clinical settings, to test and put the weight up as high as possible and test somebody's ability to lift something only one time. They would attempt the second time and their muscles are tired after one. We don't test strength that way because to improve strength, you don't want to max out the muscle. But it's important to understand that muscle strength really is about intensity. It's about doing something that's much harder than what's involved when you're training muscle endurance. And the reason this is so important for us to understand is that there are different types of muscle tissue in each muscle group. So there's fiber types that work in a way that do endurance work. So in my bicep and my thigh, got fibers that do light lifting or light work for a long period of time. Again, that endurance stuff, walking, or for my arms, holding something fairly light for a long period of time. Strength, we have strength and power fibers as well. And those fiber types of the muscle act differently. They use different energy sources. The fibers are function differently. They will be activated when you start to lift something or move in a way that it's heavy or high intensity on the muscle. So that's where that example of now, if you're all of a sudden pushing your body weight uphill instead of level, you might use strength fibers. The way to think about strength is in this type of muscle fiber activation, the intensity has to be challenging and you wouldn't be able to do it for very long. So 30 seconds or less ish, or about 10 reps is the key standard of strength training. Part of why I'm going to talk a little bit more about strength and power than endurance is that as we age, we know that our muscles change and we can lose muscle mass and we can lose muscle fibers if we're not regularly exercising. Starting at the age of 30, if you're not regularly doing strength training or power training, you can lose 10% per decade of muscle mass and those fibers that play a role in strength. We hang on to our endurance fibers late into life because we tend to use them more on a regular basis than strength and power fibers. So as people get older, when we see muscle mass loss, most of what we're seeing is loss of the strength and power fibers. So it's really important for older adults to make sure they're doing some type of resistance and strength training to combat that change that can occur in the muscle tissue. So examples of strength exercises: stairs, stepping up and down on the bottom step. Again, it's something unlike walking. You're not going to want us to do stairs for 10, 15 minutes. You might do 30 seconds and your muscles start to feel that burn. You've worked those strength fibers. Squats or push-ups off the counter, off the floor is the most challenging option, but you can do push-ups off of a wall or a counter to work the strength of your arms. And any type of resistance exercises. So adding resistance bands or weights to an exercise or a movement to help load resistance and intensity to the way you're using those muscles in a way that those muscles tire around 8 to 12 reps is what's recommended. Ways that we get strength exercise or activity in our daily life, again, stairs, including some hills. So if you have the opportunity, if you're parking somewhere for an event, a music event or a sporting event or an outdoor event, and you see an option to park where you might be able to include walking uphill to the event, include that in. Getting up and down, every time you stand up from a chair, a toilet, the car seat, the edge of the bed, you're using strength, the fibers in your leg muscles. So practicing that without pushing with your hands to add strength to your legs throughout the day. And groceries and laundry, carrying those, making sure that you're doing as much of that as you can so that you're using the strength fibers in your arms throughout the day. And I put rising on the floor on here. That's something that could be a whole hour topic in and of itself. But if that's something that oftentimes people aren't doing, maybe there's a safety reason why, or some sort of knee or physical limitation why. But getting down on the floor to clean the floor or to play with grandkids and getting back up off the floor, that's something that requires quite a bit of leg strength as well. Muscle power. Muscle power is similar concept to strength as far as lifting resistance and fatiguing in a short period of time, but it adds a time component. So it's being able to generate as much force as possible with that time component as quickly as possible. Power is very important because just like those strength fibers, those muscle fibers we see muscle power fibers decrease sooner than strength, and strength sooner than endurance. Muscle power is what's required to move very quickly if you lose your balance in order to take a step to the side, step up and over something, lift something that's heavy, push a heavy door open. Those types of things require muscle power. Examples of power exercises. We can go right back to the examples of the strength exercise examples, but adding a speed component. So when you're doing an arm curl, sometimes go fast, sometimes slow. And so one of the things that I don't hear it as much anymore, but I used to hear a lot of times people say, slow down when you're doing your exercises. Maybe family members saying that to a patient that I might be working with or other instructors. Sometimes, yes, if your goal is for control, strength, and to slow down, then yes, slow down. But every once in a while, you should be including movements and exercises that get your legs moving quickly, like a fast squat, up and down fast 5 times, so that you're including that speed for your balance reactions and for your muscle power. So throughout the day where we would use this, again, stairs require some power because you not only do you have to be able to lift your body weight up the step, you have to do it fast enough to actually power up the step. Fast walking across the street, some lights change very quickly. You think you've got time and you don't. So just picking up that speed, going from a normal gait speed to a fast gait speed requires some power in your legs. Pushing a heavy door open, and then again, those quick balance responses. Power is needed to quickly respond to prevent a fall if you lose your balance. Balance. One of my favorites. I think I think I said that about all the categories. I like talking about all of them. So balance is an exercise category that strength and power play a role in your balance. Your ability to keep your center of gravity centered over your base of support is what balance is. So right now we're doing that while we're sitting in the chair. We have our chair as a nice sturdy base of support. So it's a lot easier to stay balanced than what this woman's doing in this really unsteady position. Balance exercises, plan structured exercises. You can take time to do things like practicing standing on one leg or with your feet close together, reaching in different directions, shifting your weight, turning, moving in different directions, walking forwards, backwards, sideways. All of those types of ideas are great for balance. And then taking some sort of balance exercise class. Tai Chi is good for balance. There's a lot of weight shifting and center of gravity control, moving your center of gravity over your feet. And things that you do throughout the day that challenge your balance, everything that you're doing, standing and walking, challenges your balance to some degree. And the more active and the more variety you have in your day, as far as being up moving around, the more challenging, the more you're going to challenge your balance systems. Flexibility, the ability to move freely through your joint. So that requires joint range of motion. I keep using my arm for my elbow joint has to have good range of motion both directions in order to allow the joint to move. Examples of flexibility. I just put a few on here. Neck stretches, rotations side to side. These are great for driving, being able to look to see the lane beside you or look to see if you can if anybody's coming. Arm stretches, anything that's reaching across your body, reaching overhead, reaching back behind you, things that feel comfortable and a gentle stretch to the muscles without discomfort to the shoulder are great for shoulder range of motion. Leg stretches, bending down towards your toes. And there are a number of other leg stretches. These are just some examples of things that you could include as structured flexibility exercises. Daily activities, the more you reach overhead for things, if it feels that if you're right hand dominant and you're normally reaching up with your right hand, every once in a while, put that left hand to the test to stretch the left side. Really working on turning to look when you're driving, turning your head to look around you when you're walking. And while you're walking and balancing throughout the day, you are moving your joints through their available range of motion. So again, this is an example of the more you're up moving and the more activity you're doing, you're going to start to see that you mix a lot of these fitness components in throughout the day with your activity. Again, we're going to send the slides out so that you can refer back to this table. I'm not going to read everything on the table. I just talked about each of these key components. This is the American Council of Sports Medicine's recommendations for how many days a week you should be including each of these fitness components. And then the intensity, how challenging the exercise should be to achieve benefit. Thinking about a 0 to 10 scale, aerobic exercise should be between a 4 to 6 out of 10. Again, that's very subjective. That's based on your perception of how exerted are you. Another example I use for aerobic intensity is the talk test. Can you talk and carry on a conversation while you're walking? If you should be able to say words, but you shouldn't be able to sing a full song or comfortably have a really deep conversation with somebody next to you. You should feel like you're noticing your breath while you're talking and walking. Intensity for the strength exercise I put on here for resistance training for strength should be higher, 7 to 8 out of 10. And you should be tired by 8 to 12 reps. And that's where at the time, the next one down, I put that. So most people, that's what I want to highlight on this table. Most people that are doing some resistance training exercises may not be using enough resistance or weight or a hard enough exercise to be doing strength training. Then if you can do 20 or 30 reps on an exercise, you're probably training those endurance fibers more than the strength and power.
And a
Yes.
question, these are pretty broad recommendations, but does it include all age groups? Is it the
This
same?
is for older adults. I've pulled out
Oh.
for 65 and older. This is what's recommended.
Okay. Thank
Yep.
you.
Yep. So I'm going to move to the next slide. So ACSM talks about it in how many days per week of each of them, which I think is somewhat helpful. But what I like is the CDC and the American Heart Association and NIH have supported looking at it in minutes per week for aerobic. I think that's a better way of looking at it, but I put both of them on there. So instead of saying 5 to 7 days a week for aerobic exercise, they're recommending at least 150 minutes a week. And I like that because if the weather's really nice and you go out and garden and then you also go for a walk and another activity and you get 60 to 75 minutes of aerobic exercise one day and the next day it's rainy and you decide to do 10 minutes of treadmill walking inside or just walking in your house, then it all counts throughout the week. If you can get at least 150 minutes of aerobic exercise, you're meeting the minimum recommendation for aerobic. That can be including, again, golf is on there, gardening. This is also activity, not exercise. So remember that exercise would be, I'm planning to go on the treadmill at this time. The CDC has said it's really about activity too. It's not just structured exercise. In the week, 150 minutes of some form of physical activity or structured exercise that gets your heart rate up to a level that you would say is moderate intensity. In addition to that, 2 days a week of strength training, strength power training, flexibility training isn't on here. And the other one that's not on here because the CDC has a whole separate thing for infograph for balance and falls, 2 hours a week of something that challenges your balance. Again, I like that because you can do 5 minutes of something that challenged your balance, 10 minutes here, an hour balance class. And in the week, 2 hours during the week, you should be doing things that challenge your balance to help improve your balance and prevent falls. So those are just some things, 2 different ways of thinking about, you can think about it like the table with how many days per week and really breaking it down that way, or throughout the week, start with that foundation of the 150 minutes of activity that increases your heart rate. So that's the content that I have to share on recommendations for exercise. We're going to take a short break. I'm going to stop sharing my screen and Amanda is going to pull up her screen to talk about goal setting. While we're doing that, if you have any questions, I'll be here to answer questions on the stuff that I just talked about. If you want to step away, grab a drink, use the bathroom, we'll take a couple minutes before Amanda starts. But again, I'll stay here if anybody has any questions.
Can you say something about balance? If you're not, I've taken a few of your balance classes, but I'm thinking about how to incorporate balance into daily life when I'm, I know about, brushing your teeth and standing on one foot. Are there other things you could suggest?
Yeah, I think one of the things that gets missed a lot with balance exercises, think about balance exercises that require direction changes and moving around. So static balance, the ability to stand on one leg or stand still and do things that are challenging, that's one category. but practicing just turning around in a circle, practicing if you're at the grocery store, practice purposely moving your head around, challenging your head, your ability to walk and move around while your head is moving, your eyes are looking around, or your body is changing directions. So if you're in the kitchen, you're along the counter, you can practice some quick side steps, practice near with your hand near the counter, some backwards walking. You can practice walking like you're on a balance beam. I think those are some that people often forget to mix into the day. Barbara, did you have something?
What?
Did you have a question?
It's very strange, but I'm in my 90s and I'm fairly physically fit, I guess. But I find myself thinking I've fallen maybe 2 or 3 times. That I'm thinking too much about my walking. And if I don't think about it, do you know what I'm saying?
I do. So sometimes
Should I be thinking as much as I am about be careful on this step and that sort of thing?
so you're saying that overthinking it seems to be a
Yes.
problem?
Or should I be
Uh,
thinking as much?
That's a good question. I always say a lot of times what you're talking about comes back to a fear of falling. And how concerned should you be of falling? Everybody should have a healthy fear of falling. I should have a healthy fear of falling because I'm up moving around. If I do something that's outside of my physical capacity, like trying to run down my driveway on ice, I'm probably going to land on my rear. So the idea is a healthy fear of falling, being cautious when you know that there's a new surrounding or something that you know that your legs or your feet don't have, like could be sensitive on or vulnerable on. But overthinking it and too much of a fear of falling can also cause falls.
Yeah.
So, and part of that's because it changes the way we guard, and it changes the ability for us to naturally respond quickly to catch ourselves if we lose our balance. So I don't have a straightforward answer. If you're doing something that you like stairs, for example, I think everybody should be really cognizant of where the steps are, looking down and paying very close attention. But if you can find a place, whether it's inside your home or someplace that you like the mall to walk where you feel like it's pretty level surface, low risk for falling environment, that you can try to relax a little bit and not have to put so much focus, that would also be a good idea.
Mhm. Well, I find myself on steps being much more cautious than probably I should be to let my innate ability to do it take over, is what I'm saying.
Yeah, I think you're probably right. You want to allow yourself to do it, as long as it's, again, I always encourage people, you want to have the right amount of confidence. If you have a sense that you need to be paying close attention, as long as it's not holding you back and stiffening you up, it's probably okay.
But I find myself worrying unless there's a railing to hang on to, when I probably could do it without the railing.
Yeah. And I think, sometimes that happens too with lack of practice related to confidence. So it could be something, if you have access to stair at the bottom step, not in the middle or the top, practice a few steps with your
Okay.
hand hovering over the railing so that you know what your legs can do. You might be hesitant because maybe your legs wouldn't do it that steady, and you don't, so you may have that hesitation for a reason.
Okay, thank you.
All right, I'm going to hand it over to Amanda so that I don't take the entire time, and I'm going to mute myself and stop talking.
Okay, thank you, Anne. So before I get started, does everyone have a pen and piece of paper? We're going to do an interactive section later on where you may want those. So as Betsy mentioned in the beginning, I'm Amanda Reilley, a certified health coach through the American Council on Exercise and practice manager for Reilley Physical Therapy. And I'm going to be talking about goal setting. Many of you in this group may already be active and participate in exercise, but after listening to Anne, you may want to reevaluate your fitness program and set some new goals. Or you may be looking to get started and set goals. So a well-planned goal will increase your chances of success. SMART goals provide the clarity and focus required to get the most out of your efforts. What does SMART stand for? Goals that are specific, measurable, attainable, relevant, and time-bound. Goals are more helpful when they're specific. Since we must translate goals into actions, specific goals provide better information for creating a behavior change plan. And a goal must be specific enough that you can evaluate your progress toward it. For example, instead of improve my diet, a specific goal might be to consume 4 servings of vegetables a day. Or instead of be more active, a specific goal might be to walk outside for 20 minutes 3 times a week. It's important to incorporate some unit of measurement in your goal. Measurable goals allow you to measure your progress and assess whether you've reached your goals. For example, including things such as number of cigarettes, hours of sleep, and minutes of exercise. And less objective variables can be measured with scaling, such as a 1 through 10 level of stress. While ambitious goals elicit more effort, it's important that you feel they are within reach. For this reason, it's important to set attainable goals. So larger, more challenging and complex goals, which are also known as product goals, should be broken down into smaller, short-term goals, known as process goals, so that progress can be seen. It's easier to attain process goals where simply completing the activity accomplishes the goal, compared with product goals, such as reaching a given body weight or blood pressure. Both process and product goals are helpful, but process goals can be particularly helpful when progress towards a product goal is slow. So, for example, if you have a product goal to feel great and be able to keep up with family or friends on a trip this summer, a process goal would be to attend exercise class 3 days a week. And if progress is slower than anticipated, your goals should be revised. Relevant. It's important to choose meaningful goals that really matter to you and align with your values. People generally set higher goals and work harder towards the goals if they are perceived to be freely chosen and personally meaningful. A good example of this is someone with a goal of better managing their diabetes that also expresses interest in resuming a hobby they used to enjoy, such as dancing. In this case, improving their hemoglobin A1C is a product goal, and resuming dancing 3 nights a week is a process goal. The process goal is extremely relevant to the person, and achievement of this goal can help reach the goal of better managing their blood sugar levels. And lastly, time-bound. People want to know when they can expect to see improvements, as deadlines can increase the motivational impact of goals. So you want to spell out the approximate time it will take to reach specific goals. And it may be better to err on the conservative side so that small changes are seen as progress rather than disappointments. So we're going to pause for a few minutes. If I can have everyone think of, and if you'd like, write down a SMART goal for yourself. And if you'd like, it can be related to the physical activity guidelines that Anne discussed. So we'll take a minute for that. Okay, so I'll have you hang on to those goals, and at the end, we'll give anyone who wants to an opportunity to share. So now that you have your SMART goal, it's time to get started. One of the first steps in a behavior change plan is to identify potential barriers to your goal and then brainstorm strategies to overcome these barriers. We'll take another couple of minutes if everyone can think of a few potential barriers to their goal and strategies you might use to overcome them. So we'll give you another minute for that. Okay, and again, we'll hang on to those until the end, and we can share if anyone would like. So some other tips to keep in mind: schedule your exercise sessions. We may come across this when people share, but a lot of times time is a barrier to reaching your goals. So if you can look at your schedule and kind of carve out that time, and make sure that you stick to that for your, if you have planned exercise or, physical activity, just try to schedule that ahead of time and make it a priority. Even 5 minutes of activity matters. As Anne said, it's, the cumulative amount of activity over the week. So if you're really busy one day and 5 minutes is all you have, that's better than nothing. So. And it takes 21 days of consistency to form a habit. And lastly, Reilley Physical Therapy offers several services, including at-home outpatient physical therapy, virtual exercise classes offered over Zoom, fitness assessments, and virtual health coaching. And this is just some information on our next exercise session. It's starting Monday after Easter. And we offer live Zoom classes 5 days a week. They're all taught by Anne. She teaches both strength and balance classes. We also have a set of recorded classes that are available for makeup if someone were to have to miss a live class or they're traveling or something. And we also offer 2 different lecture topics per session. So if anyone's looking for more information on that, you can let us know. All right. And so we can open this up if anyone has any questions or anything they want to add or share. And also going back to our goals, if anyone wanted to share their goal and some of their barriers or strategies. So feel free to unmute yourself.